I had tried many diets leading up to, my surgery, and I had failed. I had lost a considerable amount of weight, but then I would put that weight back on and then some. It's very, very depressing, to see yourself take off 80 pounds and then 6 or 8 months later, you've put the 80 back on and, and then 20 or 30 more. And you feel terrible. I mean, health-wise and emotionally. There was actually 4 of us in total that came to Emory and had the gastric bypass surgery. And my sister and brother-in-law had it 1 year before my niece and I did. And I was with them every step of the way through the research process. And I looked at other facilities and everything I saw about Emory and Dr. Lynn and the program and the education, and then I saw the results that my brother-in-law and sister had the first year, led me to Emory. I mean, it was all a team, and it was great. They're with you before, and then they're with you after, with support groups. And then being able to have access to an Emory dietitian, especially when you're changing your vitamin intake and having to, add different vitamins, having access to those dietitians is also a huge benefit. The surgery to me was just giving me a tool, just like I add another tool to my toolbox at home, and I have to be able to use that tool, skillfully. Before education was critical, knowing how I had to eat the first week, the first 2 weeks, the first 6 weeks, the progression, the diet progression, and then having to stick to a diet, sticking to small quantities, and then getting back into exercise heavily. That was all key. So it's one big, program. It's not just the surgery that makes it work. It's a very serious decision, and it's a very serious commitment, and that you need to look at all the information, talk to your doctor, look at how many times you've tried to lose weight, and if it's right for you, then by all means I recommend having it done, because it will change your life as long as you follow the program from beginning to end.